Do you know the 8 symptoms of lung cancer? It's a question that might seem daunting, but understanding these symptoms is crucial. Today, we delve into a topic that's often shrouded in fear, yet is so vital to our health: lung cancer symptoms. This isn't just about spreading awareness, it's about empowering each one of us with knowledge that could potentially save lives. Over the next quarter of an hour, we'll be exploring 8 key symptoms of lung cancer, each with its own dedicated segment. We'll unravel the complexities, shed light on the subtleties, and break down the information in an easy-to-understand manner. This journey into the world of lung health is not just for those directly affected, but for everyone. Because when it comes to our health, knowledge is power. So let's start this enlightening journey together. Knowing these symptoms can be the first step in early detection. Let's take that step now. The first symptom of lung cancer we'll discuss is a persistent cough. Now let's demystify this symptom a bit. A cough in itself is not something to immediately raise alarm bells. It's a common reflex action that clears the throat of mucus or foreign irritants. We've all experienced bouts of coughing when we've had a cold, or even after laughing too hard. But when does a cough turn from being just a cough to a potential symptom of lung cancer? The key word here is persistent. We're talking about a cough that just doesn't seem to go away. It lingers on for several weeks, often becoming more severe over time. Lung cancer can cause this persistent cough due to its effect on the air passages. As a tumor grows and takes up more space in the lung, it may irritate the lining of the airways, leading to a chronic, unyielding cough. This cough can be dry, or it may produce sputum, the mucus that can be coughed up from the lungs. In some cases, the sputum may even contain traces of blood, another warning sign not to be ignored. Now, it's important to note that a persistent cough can be caused by many things other than lung cancer. Asthma, allergies, and infections like bronchitis or pneumonia are just a few examples. However, if you've been coughing for more than 2 weeks and it's not improving, it's time to seek medical advice. This is especially true if your cough is accompanied by other symptoms such as shortness of breath, chest pain, or unexplained weight loss. So let's recap. A persistent cough is a cough that doesn't go away. It's often more severe than a regular cough and can sometimes produce blood. Always remember, your body has a way of communicating with you, and a persistent cough could be its way of telling you that something's not right. If you have a cough that isn't going away, it might be more than just a common cold. Don't ignore it. Reach out to a healthcare professional and get it checked out. It's always better to be safe than sorry. The second symptom is changes in a cough you already have. Now, it's crucial to understand that coughs are common, especially during certain times of the year. However, a shift in your typical cough could be an indication of something more serious, like lung cancer. So, what changes should you be on the lookout for? Well, it could be a cough that's become more persistent or more pronounced. Perhaps you've noticed that your cough has become deeper or harsher. Maybe it's disturbing your sleep more than it used to, or it's causing you discomfort or even pain. But it's not just about the intensity or frequency of the cough. It's also about what comes out when you cough. Are you coughing up blood or rust-colored phlegm? That's certainly not something to brush off. While it doesn't automatically mean you have lung cancer, it's a symptom that definitely warrants a visit to the doctor. Another thing to keep in mind is that changes in your cough might be accompanied by other symptoms. You might experience shortness of breath, chest pain, or weight loss, for instance. These could all be signs pointing to lung cancer. Now, it's important not to panic at the first sign of a changing cough. Remember, it could just be a common cold or a lingering case of bronchitis. But it's also crucial not to shrug it off completely, especially if the changes persist for 2 weeks or more. When it comes to lung cancer, early detection can make a significant difference in the outcome. So, listen to your body. It knows when something isn't right, and it tries to alert you in its own way. A change in your cough could be one of those alerts. It's your body's way of saying, hey, something's not right here. It's your job to heed that call and take the necessary steps to figure out what's going on. Don't ignore changes in your cough. It could be a signal your body is sending. Breathing difficulties can also indicate lung cancer. Now that's a phrase that could stop anyone in their tracks. We all know breathing is as natural as, well, breathing. It's something we do without even thinking about it. But when lung cancer enters the picture, this effortless act can become a conscious struggle. So how does lung cancer mess with our breathing? Think of your lungs as a pair of sponges, flexible and porous, filling up and emptying out with every breath. But when a cancerous growth sets up camp in these sponges, it's like dropping a stone in the water. The stone takes up space, displacing the water and leaving less room for it. Similarly, a tumor in the lungs takes up space that should be filled with air, making it harder to breathe. Now, it's important to distinguish between normal breathlessness and symptom-related breathlessness. We've all felt out of breath, maybe after a sprint, a bout of intense exercise, or even climbing a flight of stairs. That's normal. Your body needs more oxygen, your heart rate goes up, you breathe faster, but then you rest and your breath comes back to you, easy as ever. Symptom-related breathlessness is different. It's a feeling of being unable to catch your breath, even when you're at rest. It's a feeling of tightness or constriction in your chest. It may come on suddenly or gradually get worse over time. You may find yourself gasping for air or feel like you can't breathe deeply enough. And importantly, it doesn't get better with rest. Remember, everyone's experience with breathlessness will be different. It's all about what's normal for you. If you notice a change in your breathing, or if you find yourself getting out of breath more easily than usual, it's time to get it checked out. Struggling to breathe is never normal. Don't overlook it. Your lungs are your lifeline, and any change in their function deserves your attention. If you're experiencing breathing difficulties, don't hesitate to seek medical advice. It could be a lifesaver. Your feedback drives this channel forward. Whether it's a suggestion, a personal story, or just a simple hello, I'd love to see your comments below. Your interaction makes this community stronger and helps us all learn from each other. Don't be shy, join the conversation. Chest pain is another symptom of lung cancer. It's something we often associate with heart problems, but it's important to know that this discomfort can also be linked to issues with our lungs. When it comes to lung cancer, chest pain can manifest in a variety of ways, and it's essential to understand these differences. Firstly, you might experience a dull, aching sensation in the chest. This type of pain is usually constant, doesn't change with your body position, and may even intensify during deep breaths or coughs. It's like a persistent, nagging discomfort that refuses to go away. Secondly, the pain can be sharp and stabbing. This kind of pain typically comes and goes and can get worse with certain movements or deep breaths. It's like a sudden jolt that catches you off guard and then recedes, only to return again. Lastly, some people may feel a tight, squeezing sensation in their chest. It's like an invisible band is constricting your chest, making it difficult to breathe. This type of pain can be particularly distressing because it can mimic the symptoms of a heart attack. Now, it's important to remember that not all chest pain is due to lung cancer. There are numerous other reasons for chest pain, including heart disease, gastrointestinal issues, and even muscle strain. However, if the pain is persistent, worsening, or accompanied by other symptoms like a persistent cough, shortness of breath, or unexplained weight loss, it's time to seek medical attention. Never ignore chest pain, especially if it's a new symptom for you. While it may not necessarily mean you have lung cancer, it's a signal from your body that something isn't right. And remember, early detection is key in managing any health condition, including lung cancer. So listen to your body. If your chest is in pain, don't brush it off as nothing. Seek medical help and get it checked out. It's always better to be safe than sorry. Remember, your health is your wealth, and you deserve to live a life free from pain and discomfort. Chest pain can be a serious sign. Always consult with your doctor. Hoarseness or voice changes can be a symptom of lung cancer. Now that statement might raise some eyebrows. After all, what does our voice have to do with our lungs? Quite a bit, as it turns out. To understand why, let's take a quick dive into how our voice works. When we speak, air from our lungs passes through the vocal cords in our voice box, or larynx, causing them to vibrate. This vibration creates sound, which we shape into words with our mouth and tongue. Hoarseness, in medical terms, refers to abnormal voice changes. These changes can include a raspy or strained voice, a lower pitch, or even voice loss. It happens when something disrupts the normal vibration of the vocal cords. And guess what can cause such disruption? Yes, you got it, lung cancer. When a lung tumor grows, it can press on the nerve that controls the larynx, causing hoarseness. This is often a later stage symptom, but it can also be one of the earliest, depending on where the tumor is located. Now, it's important to note that hoarseness is a common symptom and can be caused by many things other than lung cancer, such as a simple cold, overuse of the voice, or allergies. However, if you've been hoarse for an extended period, say 2 weeks or more, without a clear cause like a cold, it's a good idea to consult a doctor. Also, if the hoarseness is accompanied by other lung cancer symptoms we've discussed, like a persistent cough, breathlessness, or chest pain, it becomes even more crucial to seek medical advice. Remember, early detection of lung cancer significantly increases the chances of successful treatment. So, while it may feel awkward to go to the doctor because your voice is a bit raspy, doing so could potentially save your life. So, the next time you notice your voice sounding a bit off, don't just brush it off as a sign of aging or a leftover from a night of karaoke. Listen to your body. Even subtle changes in your voice might be a symptom. Unexpected weight loss can be a symptom of lung cancer. Now, this is a symptom that many of us might initially welcome, given our society's obsession with slimming down. But in the context of lung cancer, such weight loss is far from a cause for celebration. So how does lung cancer cause weight loss? Well, lung cancer cells are greedy little things. They demand a lot of energy as they multiply and spread. And where do they get this energy? From your body, of course. They literally eat away at your body's resources, causing you to lose weight. This is not the kind of diet you want to be on. But wait, there's more. Lung cancer can also cause a decrease in appetite. The disease and its treatment can make food taste different or cause nausea, making it difficult for patients to maintain their usual food intake. This, combined with the energy demands of the cancer cells, can lead to significant weight loss. Now, we all know that weight can fluctuate for a variety of reasons. So when should you be concerned about weight loss in relation to lung cancer? Well, if you're losing weight without trying, and especially if you're also experiencing other symptoms we've discussed, such as a persistent cough or breathing difficulties, then it's time to consult a doctor. But remember, not all weight loss is a sign of lung cancer. Stress, changes in diet or exercise, and other health conditions can also cause you to shed pounds. However, if you're losing weight and you're not sure why, it's always wise to seek medical advice. You know your body better than anyone else, so pay attention to it. If something doesn't feel right, don't ignore it. Seek help. Your body is the vehicle that carries you through life, and it deserves your care and attention. And that includes taking note of any unexplained changes in your weight. Your health is your wealth, after all. Take note of any unexplained changes in your weight. Bone pain is another potential symptom of lung cancer. Lung cancer has a reputation for being a silent assassin, often revealing itself in the late stages when it has already spread to other parts of the body. When this happens, one of the areas it commonly affects is the bones, causing significant discomfort and pain. Pain is your body's way of communicating that something isn't right. When cancer cells invade your bones, they interfere with the bone's normal function and integrity, leading to pain. The pain can be either acute or chronic. Acute pain is sudden and severe, often described as a sharp stab or a break. On the other hand, chronic bone pain is persistent and may range from a dull ache to a throbbing sensation. The pain can be localized, affecting a specific area like the back or hips, or it may be widespread, affecting multiple areas of the body. It can be constant, or it may come and go. It may also intensify at night or when you're resting. The severity of bone pain can vary greatly from person to person, and it's influenced by factors such as the location of the cancer, the size of the tumor, and the individual's pain tolerance. It's important to note that bone pain is a common symptom of many conditions, not just lung cancer. It could be a sign of arthritis, osteoporosis, or even just the result of physical strain or injury. However, if you're experiencing persistent, unexplained bone pain, particularly if it's accompanied by other symptoms we've discussed like a persistent cough or unexplained weight loss. It's crucial to consult a healthcare professional. Early detection is key in the fight against lung cancer. It can mean the difference between a curable condition and one that is much more difficult to treat. Always listen to your body. If something feels off, it's better to be safe than sorry. Your health is your most valuable asset, and it's important to take care of it. Unexplained bone pain should never be ignored. The final symptom we'll discuss today is headaches. Now, we've all experienced headaches at some point in our lives. They're usually nothing more than an inconvenient disruption of our day, perhaps due to stress, dehydration, or lack of sleep. However, when it comes to lung cancer, headaches can take on a more sinister role. Lung cancer can potentially cause headaches through a variety of methods. One of the underlying causes is the metastasis of cancer cells. In simpler terms, it means that the cancer cells from the lungs have traveled and spread to other parts of the body, including the brain. This can increase pressure within the skull, leading to headaches. Another reason could be paraneoplastic syndromes, conditions that arise when the immune system responds not just to the cancer, but also to normal tissues, causing inflammation. This can result in headaches as well. Now, you might be wondering how to distinguish between an everyday headache and one that might be a symptom of lung cancer. It's not an easy task, and it largely depends on the individual's experiences and health history. However, headaches associated with lung cancer are often different from the ones we usually experience. They might be more persistent, lasting for longer periods, and could be accompanied by other symptoms such as changes in vision or speech, confusion, or seizures. Of course, having a headache doesn't automatically mean you have lung cancer. It's one symptom among many, and it could be caused by a multitude of other factors. But if you're experiencing persistent headaches, especially in conjunction with other symptoms we've discussed in this series, it's important to consult a healthcare professional. Early detection and treatment of lung cancer can significantly improve outcomes. So, any persistent or unusual symptom should be taken seriously and not brushed off as a mere inconvenience. In conclusion, a persistent headache might be more than just a nuisance. It could be a sign of lung cancer. So, those are the 8 symptoms of lung cancer. Let's take a moment to recap what we've learned. Persistent cough, changes in cough, breathing difficulties, chest pain, hoarseness, weight loss, bone pain, and headaches. These are the 8 harbingers of lung cancer that we must remain vigilant of. A persistent cough is not to be taken lightly. It could be a sign of lung cancer, particularly if it's accompanied by changes in the cough's nature. Breathing difficulties and chest pain can often be dismissed as signs of aging or being out of shape, but they could be your body's way of raising a red flag. Hoarseness, while seemingly innocuous, can be a sign of a tumor pressing on the nerves that control the vocal cords. So don't dismiss a raspy voice. Unexplained weight loss is another symptom that can often be overlooked. It's crucial to pay attention to your body and note any significant changes. Bone pain and headaches might seem unrelated to lung cancer, but these symptoms might indicate that the cancer has spread to the bones or the brain. Each of these symptoms holds significant weight and should never be dismissed or neglected. Early detection is crucial in the fight against lung cancer. The sooner it's diagnosed, the better the outcome can be. Don't wait for these symptoms to become unbearable. If you notice any of them, it's important to see your doctor. The key to beating lung cancer lies in early detection and immediate action. Remember, it's your health, and you are the first line of defense. Pay attention to your body. Listen to what it's trying to tell you. If you notice any of these symptoms persisting, seek medical attention. Thank you for joining me on this journey to better understand lung cancer symptoms. Your feedback drives this channel forward. Whether it's a suggestion, a personal story, or just a simple hello, I'd love to see your comments below. Your interaction makes this community stronger and helps us all learn from each other. Don't be shy. Join the conversation.